Hello, in this video I'll be sharing important information about antidepressants. If you're currently using antidepressants or looking to learn more, make sure to watch the video until the end. Section 1. What are antidepressants? Antidepressants are medications commonly used in the treatment of mental health conditions such as depression and anxiety. They aim to regulate the chemical balance in the brain to improve mood. However, each type of antidepressant works differently and may have varying effects. That's why it's crucial to follow your doctor's advice when selecting the right one for you. Section 2. Types of antidepressants. Antidepressants can generally be categorized into several groups. Each group works in its own way. 1. Selective serotonin reuptake inhibitors, SSRIs. These medications work by increasing serotonin levels in the brain to enhance mood. Common examples include fluoxetine, Prozac, sertraline, Zoloft, and citalopram, Celexa. 2. Serotonin norepinephrine reuptake inhibitors, SNRIs. These increase both serotonin and norepinephrine levels to improve mood. Examples include venlafaxine Effexor and duloxetine Cymbalta. 3. Tricyclic antidepressants, TCAs. These affect serotonin, norepinephrine, and other neurotransmitters. Examples include amitriptyline and imipramine. 4. Monoamine oxidase inhibitors. These inhibit the monoamine oxidase enzyme, which helps improve symptoms of depression. Examples include phenelzine and tranylcypromine. Section 3. Effects of antidepressants. Antidepressants primarily aim to reduce symptoms of depression and anxiety, but their effectiveness may vary from person to person. The main benefits of antidepressants include improved mood. Depression and anxiety symptoms can be reduced, making individuals feel better overall. Increased energy and focus. Energy levels may improve, and the person may be able to concentrate better. Improved sleep patterns. Antidepressants can help regulate sleep issues that often accompany mental health conditions. However, some antidepressants may also cause the following side effects. Sexual side effects. Some people may experience a decrease in sexual desire or issues with sexual performance. Appetite changes. Changes in appetite, either an increase or decrease, can occur. Fatigue and insomnia. Some individuals may experience tiredness or difficulty sleeping when they first start taking antidepressants. Section 4. How to use antidepressants and recommendations. 1. Use with a doctor's prescription. Antidepressants should only be used under a doctor's supervision. Never take them without professional guidance. 2. Start slowly and be patient. Antidepressants may take several weeks to show their full effect. It's important to be patient during this time. 3. Regular use. It's essential to take antidepressants regularly and not skip doses, as this can disrupt the treatment process. 4. Monitor side effects. If you experience any side effects, it's important to stay in touch with your doctor for proper guidance. 5. Avoid alcohol and other medications. Alcohol can interact negatively with antidepressants, and if you're on any other medications, you should inform your doctor. Section 5. Safety and risks. While antidepressants are generally safe, they do carry some risks. In particular, young people and adolescents may experience increased suicidal thoughts when starting treatment. Therefore, it's crucial for those on antidepressants to be closely monitored during the early stages of treatment. If you found this video helpful, please like it and subscribe to my channel. If you have any questions about antidepressants or other treatments, feel free to leave a comment below. Thanks for watching, and I wish you good health.